We talk about facelifting. Obviously, we talk about the texture or the fabric of the skin and the sagging nature of the skin. We've already approached and discussed what we do in order to maintain a facelift and how we improve the fine lines, the pigmentation through the use of creams and other different types of programs. So to try to explain to you the very different options that we have available, I'm just going to tell you a little history. For millennia, patients or individuals were injured with arrows and caustic oils and stuff like that, okay, and finally bullets up in World War I. Well, after that, the only thing that they could do is put a little rag on top of it and let it heal, and these scars would contort what was going on. So what happened at that time that allowed us in this last 100 years to be able to develop the facelift was anesthesia and the curiosity of the individuals to start looking inside the face and what they could do with the face. So it first started with Reconstruction, and that would be take the hole out. Now, how do you pull it together? So they looked at the different layers, all right? In the 1950s, pioneers started saying, well, we can start using all those layers in order to try to improve the way people looking. They're living longer, they want to look better. So it was the aristocracy in the early 1900s that said, look, I'm looking old, okay? The head and neck surgeons of that time said, just take this fold off, and all they did was cut off a fold, put it together with a couple of truly cat sinew, cat's gut, okay? And that's the way the facelift started. Thereafter, they started placing the incisions where you could least see them, and that has evolved. And then after that, it became, as I explained to you earlier, just a one facelift approach. But as we learned about all the different layers, we realized you can take different layers to pull them one way or the other way and not have this windblown effect of this one layer facelifting that was done in the 50s. In the 60s, they started identifying a different layer, and it was more like fascia, more like gristle. It was really tough so that you could suspend the skin and then just redrape naturally the outer layer of the skin. That was called the SMAS. The SMAS could be imbricated, which is to take the tissues and fold them over on themselves and sew it. And it started down here, then it went up to here, then it went up to here, and you could see how it would pull the tissues up directly from where they came. The cheek and the jowl and so forth were pulled back up where they were. The brow could be pulled up in this direction, and then the neck could be pulled up in this direction. And so that was called SMAS imbrication. Then there was a SMAS lift, where they actually lifted that particular plane and pulled it in the same direction. So the SMAS would be pulled up, but the skin would be redraped in a natural direction upward. All right. So there were people that weren't happy because they weren't getting their cheeks lifted enough, and that's where the deep plane came in. The deep plane in something called endoscopic facelift was using smaller incisions going down to the bone, and in a sense lifting all the tissues, including the muscles and the glands and everything up, and then trying to pull everything up, similar to what we do with the medicine Botox. All right, but people weren't happy because the tissues would slide over that. And so they needed a skin lift also as well. So all these combinations by different people with different talents and skills developed. Then they did a twin study where these 4 different types of procedures were done, okay, and compared at 1, 5, and 10 years. They all ended up having almost the same final duration and effects. So ultimately what we tell the patient is that I, in particular, will use an individualized approach according to what your needs are. Now, there is more risk, more swelling, more downtime with a deep plane facelift. So I've chosen not to do that. Most patients want to get rid of the slide of tissues, and so therefore I use this 2-plane technique that's individualized to the patient. So now you know how I do facelifts.